Bismillah ar-Rahman ar-Rahim. The title of this study is Malignant Lesions, Mimicking Endodontic Pathoses Lesion, a Systematic Review. This was published in GOE in 2021 by Schuch et al. The purpose of this study or this review was to integrate the information on recording publishing on malignant lesion that mimic endodontic pathoses into a comprehensive analysis in their clinical, radiographical, and histological features. Material method that was an online search made on 2020, and the date is not construction on PubMed and Web Science. Scopus. Inclusion criteria. They include the case series, case report, and cross-sectional studies, and full text that available online, and the data was assessed and described. In their result, out of 49 publication from 16 countries, on 60 cases they were included. That nearly equal occurrence rate between male and female with no gender differences. And the mean age of occurrence is 46 years. Sixth decade of life, the most prevalent, and the fifth decade followed by the sixth decade. And more prevalence in the posterior mandibular by 40.6%, followed by anterior maxillary area, which is 25%. Radiographically, lesions were unilocular in most of the cases, like 98%, and the lesions were ill-defined and not really clear. That was representing 78%. Then clinically, the patient showed that loss of cortical bone in 83% and mobility in 52%, tooth resorption in 53%, and symptoms were in most of the cases. We're speaking about 90%. Bone swelling and tenderness over the affected area, pain, paresthesia were detected in the majority of the studies that were reporting the cases. And the histopathological analysis showed that the most common or the most prevalent was the metastatic lesion in 27%, and followed by salivary gland malignant disease, sarcoma, and lymphoma, and then the least is carcinoma by 10%. Tooth mobility and bone resorption were not reported for salivary gland tumors. In this article, they conclude that the present systematic review revealed that histological type of malignant preapical lesion could be mimicking endodontic pathoses, and because that those lesion usually is not showing clinically or radiographic features of malignancy, and clinicians should consider this type of lesion and should be involved in routine investigation during the treatment. Thank you.